Allow me to reintroduce myself.
It's your favorite Dr. Harry. So what are the risk factors of cancer? Most people with cancer are always desperate to know what could have caused their disease. Is this something that they did? Is this something that they could have prevented? A previous history of cancer, especially for germline mutations, is the strongest risk factor. In fact, there's a study that was done in Denmark. It showed that people who have been diagnosed with cancer previously are at increased risk of developing cancer compared to people who have no history at all. Another risk factor is age. As I said earlier, the longer you live, the greater the chance of you developing any type of disease. So mutations accumulate over time. They eventually become cancerous. Another risk factor is family history, especially for first-degree relatives. Who are your first-degree relatives? Your father, your mother, your siblings, this is your brother or sister, your child. I want you to understand that having a relative who has cancer is not a guarantee that you will have cancer. In fact, most people who have relatives with faulty genes usually normally don't inherit them. So the strength of family history depends on who in your family was diagnosed with cancer, what type of cancer were they diagnosed with, and at what age were they diagnosed with this cancer, how closely related these relatives were. The greater the number of relatives who are diagnosed with the same type of cancer or related cancer, that's from your father's side or your mother's side, and the younger the age at which they were diagnosed with cancer, the greater the risk. If, for instance, your relative was diagnosed with cancer or was found to have a faulty gene, we normally recommend you to screen before the age of 45, like in the case of breast cancer and colorectal cancer. And in some instances, some people are diagnosed with cancer when they are much younger, like the case of Chadwick Boseman, who was diagnosed and died of colorectal cancer at age 40. So in this case, we normally recommend you to screen 10 years before the age at which they were diagnosed with cancer. Some other risk factors, especially for acquired mutations, may include smoking, obesity, alcohol consumption, viruses such as HPV, HIV, and also exposure to chemicals like asbestos, arsenic, benzene, beryllium, nickel, and exposure to UV radiations from the sun.
Allow me to reintroduce myself.
It's your favorite Dr. Harry.